Good afternoon and welcome to Webinar Wednesday. We're excited to have over 230 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. Today's sponsor, Nuvolo, is headquartered in New Jersey. Name the New Jersey native who stars in the Mission Impossible movie series. Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to join us for our annual Imaging Conference and Expo, which will be held February the 17th to 19th, 2019, at the Wyndham Grand Resort Hotel, Clearwater, Florida. The ICE conference will bring imaging service professionals from across the nation to Clearwater for 3 days of learning, networking, and the latest advances in imaging. Registration is now open, so details can be found at attendees.com. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is. And it is we've got Courtney Hasher. Courtney, I hope I pronounced your name properly. Congratulations, the correct answer is Tom Cruise. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo is a modern cloud-based EAM platform that meets the highest standards for ease of use, performance, and online and offline mobility capability for managing clinical equipment for healthcare providers. Visit nuvolo.com for more information. Our presenter today is Kyle Holetz, Senior Solution Consultant at Nuvolo. Kyle, you may begin whenever you're ready.
All right, thank you very much for the intro, Linda. And also I want to take a quick second just to thank everybody on the line today for spending an hour with myself and the Nuvolo crew. We do greatly appreciate it, and I look forward to presenting to you all today. So as you all probably can see, the topic of today's webinar is modern analytics and reporting. So we're really going to be focusing on 2 areas today. How we can make better decisions as an organization and drive compliance without the need for extra work, excuse me. So a little bit about myself. Once again, my name is Kyle Holetz. I'm one of the solution consultants over here at Nuvolo. I've been working in the healthcare technology management industry and primarily in the CMMS side of things for a number of years. I've had the opportunity to be a founding member of another CMMS company and really see how CMMS has changed and evolved over the last 10 years to what we thought was traditionally somewhat of an underserved area. And I really like the vision of what Nuvolo offers to our customers in the whole single pane of glass to manage your entire business from clinical facilities, environmental services, and so on. So I'm really looking forward to presenting to you all today. So what are we going to cover today? So what we're going to talk about first is sort of the current state of CMMS systems and specifically reporting and analytics. We're then going to jump into just a few slides around compliance reporting, joint commission reporting, environment of care reporting, and also some methodologies that we've instilled in our product around AEM. Then I want to get into sort of what Nuvolo offers in terms of a future state. And then lastly, go through the live presentation, which will take up a bulk of today's hour. So what is the current state of CMMS and HTM reporting? So, what we've seen and what I've observed in the industry is there's a number of technology, challenges. We've seen that, our customers have traditionally been handcuffed by CMMS systems in terms of process, right? The software system operates one particular way, and that forces your health system or hospital to mold your process or manipulate your process because that's the way that the software operates, right? And at Nuvolo, that's not our goal. We want to offer a technology that can grow and evolve with your business and the processes that you've specifically instilled. One of the other things I've noticed is a lot of the systems don't really help to accomplish work or make better decisions, right? And this all comes back to data governance, which we're going to talk a little bit about today. But pulling a piece of paper off of a printer and taking it to a device, and then coming back to your desk or computer and updating that information, that's not exactly helping you service a device, right? Of having real-time insight into the device history and those sorts of things. We've seen a lot of working around the system. So whether that's exporting data to Excel, manipulating it there, and then re-importing it back into the system, And like I mentioned, printed work orders. And lastly, you know, data governance is very big, right? Your reporting and analytics really is only as good as the data that's going in. And without a strong data governance model, that can be, you know, it can be difficult. It can be challenging to pull useful reports, or those reports need to, you know, have heavy manual effort or manipulation done to them, so you know that you're getting something accurate. We've noticed a lot of reporting gaps, right? A lot of areas or a lot of systems that we've seen, you have to sync your system or download data every so many minutes. Or there's a large manual effort required when, you know, Joint Commission comes knocking at the door, it's time to do EOC rounds and those sorts of things. That requires a massive manual effort on you know, our colleagues, on everyone that's listening in today. And really, we want to try and eliminate a lot of that. We've also seen that, you know, a lot of the systems truly aren't exactly, they're not the most intuitive out there. They don't help with self-service, right? And one of the things that, you know, we strive to do at Nuvolo is offer consumer applications, right? So no one teaches you how to use applications like Amazon and Uber and apps that we use every day that would be considered, you know, quote unquote modern apps. And we strive to do the same thing with Nuvolo, right? We don't want to have heavy training before, you know, someone uses our application. We truly pride ourselves on hoping that it is a very intuitive, very straightforward process. And then lastly, you know, we're noticing a lot of vendor assistance is required. You know, if you folks need a new report or want to start working from some new dashboard, a lot of times that requires a vendor to build that for you, which ultimately translates to more dollars on the consulting end. Also, ease of use, you know, so one of the challenges is just, once again, an inconsistent experience, you having to go to an inventory system to use a part on a work order, swivel chairing between systems just to accomplish simple daily work. And one of the things that I've had a great opportunity to do throughout my career is actually go to a number of health systems and sit in the shop with the biomed technicians, right? And truly just not say anything, just sit, observe, take notes. And what that's allowed me to do, and one of the things that really stuck out, is how much time people spent just looking for important data, right? Whether that be an asset's work history, whether it be a work order that you weren't able to finish, you know, the day before and you need to go back to. I was always blown away at the difficulty of doing simple things like finding information that you need to accomplish work, right? Tactical information. And then lastly, limited flexibility, right? So this kind of goes hand in hand with number one in technology challenges, but a lot of vendor assistance is required. And what we try and do with Nuvolo and offer something to our customers is a true sense of control for you, right? So if you want a new report to be built or add a new field to a form, you know, just make a field mandatory, something along those lines to improve that data governance model. That's traditionally required vendor assistance. And what we do at Nuvolo is we open that up to our customers and we let you guys control that. And of course, we're there to help too, right? We're not just going to turn something over and turn our backs, but we want to enable our customers to handle those sorts of those areas themselves. And also, you know, we do offer, if any request comes in that takes less than 3 hours, we actually offer that for free service, whether it be, you know, making a report, adding a field, those sorts of things. And then lastly, a system that doesn't evolve with customer, you know, business evolution and changing regulations. As we all know on this call, you know, our industry is constantly changing. You know, the Joint Commission recently switching all PM completion rates to 100%. That has a major effect on the way we do work, and the system needs to, you know, take into consideration those things and change with those regulations. So I briefly want to hit on compliance reporting. So the first block here, the Joint Commission, right? I was recently reading an article from George Mills, and it was really talking about how the Joint Commission wants to see from everybody that you are doing, how can you prove that you're doing what you say you're going to do, right? Whether it be an AEM plan where you're completing, you know, you're doing 95% completion rates on your infusion pumps. How can you prove that you're actually hitting that percentage? And how can you prove that, you know, your AEM plans are properly qualified and what you've changed from the OEM plan and those sorts of things? And as we all know, the Joint Commission is heavily, you know, wrapped around PM completion. So how can we see a solid device history that's easy to access and then report on PM completion in a number of different ways? And then lastly, you know, the AEM bullet at the bottom, we're going to get into this in the demo today in terms of how Nuvolo's developed a methodology around, requesting, qualifying, and tracking performance of AEM plans throughout their life cycle, right? We're also going to get into environment of care dashboards. So how are we showing performance towards our organizational goals? How can we provide you a sort of environment of care template or dashboard, which you can rotate your reports in very easily, whether it be your main components being scheduled maintenance, unscheduled maintenance, and then things like hazard alerts and safety recalls and those sorts of things. And how can we help you prove that you're ensuring that safe environment for patients and also staff? And then what that all wraps up into, of course, is operational compliance, right? So how are we making sure and helping our customers receive the highest, Medicare and Medicaid reimbursements, instilling that they have a good reputation throughout the industry, because these findings that the Joint Commission is when they're auditing folks, these are publicly available, right? So it's out there, people can see this information, and how can we help that not be such a headache on our customers is a major area for us. So I quickly want to talk about, the AEM lifecycle process, and we're going to get into this in the demo today. And the way we built our AEM plans really wraps around these three areas, right? Requests coming in from a technician, high level, of ideas of why they think they should change the procedures against this model, and also what they think we should change it to in terms of an AEM plan, and we'll get into that. And then after that request comes into the system, how can a manager then qualify that request to decide, hey, is this a good candidate for AEM or is it not? With, of course, taking into consideration things like lasers and imaging devices where you just can't perform AEM. And then lastly, how can we show that this was a good decision, right? How can we prove through, a baseline generation of dates and pulling in a baseline range of data against when that device has been on an AEM range? How can we show through ongoing metrics that the move that we've made, that change that we've made to the maintenance of our devices was a good decision? So we're going to get into all that in the demo, and I'm looking forward to y'all seeing that. So then lastly, what is Nuvolo's solution? This kind of hits on to what we're going to talk about today, right? Starting out at the top, right? You have to have a solid foundation. You have to have a great data governance model and be able to control that. There has to be system force processes, mandatory fields before any record is submitted, and we want our customers to be at the forefront and controlling all of those areas. So point of service compliance, this gets to the mobile strategy, right? So I'm briefly, when we're talking about sort of laying that foundation, I'm briefly going to hit on some of our mobile strategies and how we can, ensure that your data is staying clean and you don't have, 3 GE healthcare manufacturer records in your system. And a lot of that comes back to a really solid mobile strategy. How can you take an iPad or a phone to the device, service the device, update your information directly from the spot that you're servicing it, whether you're online or offline? Also, we're going to talk about reporting flexibility. So how can you slice and dice PM data the way that you desire, right? We all know that there's a lack of standardization and people report on PM completion very differently across the industry. So how can we give you some templates and sort of baseline starting points that are prescriptive reports that you can either use out of the box or you can manipulate, as needed, without the need for vendor intervention, right? So we don't want to have to come in and bill anybody for building reports. We want our customers to have the ability to do that. So then we want to talk about department visibility, right? How can we keep real-time metrics in front of the workforce at all times, right? And I've seen a lot of our customers do things like put reports on big screens in the shops on like a carousel, right? And it's switching reports throughout the day. So things like PM compliance and new work orders coming in, it's staying in front of your staff at all times. It's always available. And then lastly, once again, kind of getting back to the data governance, providing a solid foundation, right? A prescriptive tactical starting point for our customers to work from. And that comes, through a number of fashions that we're going to talk about today. So now, what am I going to go through in our demonstration? So we're going to start out by going through some dashboards, some operational and financial dashboards as sort of an end goal, right? This is where we're trying to get. But before that, we have to have a solid data governance model. So I want to show that end goal. We're then going to jump into how we're providing that solid foundation, whether it be, standardizing classifications by FDA UDIs or against ECRI or Flexera BDNA. Then we're going to talk about, once again, like I mentioned very briefly, just the mobile strategy, right? How can we provide a solid mobile strategy? So we're collecting the data that we need to make the best decisions at the point of service. And then we're really just going to get deep into a lot of different out-of-the-box dashboards and reporting capabilities that we offer to our customers. So with that, we're going to jump right in here. So what I like to do right in the beginning, just so everybody kind of has an idea of where I'm clicking and navigating, is just do a very quick user interface overview for those of you who aren't familiar with ServiceNow. So what you're seeing in this middle main section of the screen here, this is called the content pane, right? This is where I interact with reports, I build reports, I create assets, do work orders, all of that. Across the top, you have your banner. So this is going to be, of course, branded to you, to your organization, who's logged in, right? So you can see, you know, whether you're using single sign-on or anything like that. And then lastly, you have your left-hand navigator. So this is where you do all navigation to things like work orders. So if I type in, you know, you can see all my instances of work orders, things like that. And that's where you can click around to work orders, assets, anything like that, as well as you can make favorites, right? So I have a favorites bar, so I can see a few of the items that I work with all the time. I can create these types of favorites. And additionally, the system is fully role-based, so you only have access to what your leadership has deemed that you have access to. I'm a platform admin, which is why I have so much information over here on the left-hand side. Most users might only have, like you see here, a couple different modules. So with that, I'm going to hit on quickly just these two dashboards. I want to hit on operational, which is pulled up now, and then this financial tab. So like I mentioned, this is that end goal, right? So this is coming in and saying, how can we streamline our operations and in real time get the information that we care most about? I personally like to look at these dashboards in two different ways. Either tactical information that's helping me get work done, or look for outliers. Now, what I mean by that is like this first report, looking at this week's unfinished work. I can see, what my technicians have unfinished. And for instance, if I look at Clinical Repair Tech 1 here, he has 40 unfinished work orders. So I might want to offload some of that. And if I scroll over to, who these are assigned to, I can simply click and drag directly from a dashboard and do something like potentially reassign some of this work to, another technician to offload some of that burden. So if I just continue down the line really quickly, right, keeping an eye on overdue PM assignments by technicians, our invoices. So what do we have pending? What do we have approved, rejected? This could be, invoices coming in, or if we're billing, outside services, which has been a big area that I've heard of a lot of our customers doing lately. Also keeping an eye on work tracking, right? So for instance, at Dallas Hospital here, why are my technicians traveling or punching so much travel time at this particular location? That leads into decisions like maybe I need to, hire another in-house technician, things like that. And keep in mind, these dashboards are all real time. It's all updated as work's being done. So work closed. And then one good one here that I like to show is abnormal damages, right? And this kind of gets into EOC reporting. What of our departments are abusing devices, right? So if we have an initiative to better train staff for work orders that are coming in via training issues or physical abuse or those sorts of things, you can keep your eye on dependent on those problem and resolution codes that are being updated on work orders. You can know where problems are arising and things like that. So now we're going to flip over to the financial tab here. And this tab is just, as you would assume, based completely around the financial aspects of accomplishing our work, right? This is all being fed through that solid data governance model as we're adding assets to the system, as cost of service ratios are increasing and expenses are being, recorded against work orders and things like that. So right at the top, you can see, what are my lifecycle contract costs? So all of this data is being fed directly in through the contract records. Every contract, has assets associated to it. And then as work is being done on those assets, it's automatically updating that cost. So you can get that real ROI driving, that information driving decisions for contracts. So when, GE or whoever comes in to renew their $10 million imaging contract at the end of the year, you can look back and have real ammunition to say, okay, guys, we've only utilized your contract to 70%. We're going to pay you X amount of dollars because I can prove to you this is how much we've utilized your contract from our data, right? So as we scroll down on the left-hand side, keeping an eye on things like travel costs, part costs, And then something like condition assessments can be very important, right? So which of my devices need to be replaced, are broken, are worn? And then additionally, knowing that by something like department. So if I change this report, I can see, for instance, in sterile supply, it looks like, we have a lot of our mini infuser pumps that need to be replaced, right? Or are getting worn or sort of ending that life. So getting into things like repair versus replace strategies, right? So this report's looking at which of my devices grouped by, manufacturer down here that are above $5,000 have a high cost of service ratio, and what's the number of them that have hit that sort of replace margin as opposed to us repairing it. And what our customers have done from this, right, is they've driven flags on work orders, for example, to say when a work order comes in on one of these devices, maybe you should think about replacing it as opposed to sinking more money into repairing it. Keeping an eye on quarterly spend by manufacturer and department, so you can see, once again, this is a big outlier report, right? So I can see a massive chunk of money was spent with Hospira from our central supply. I can jump in there, I can investigate why that took place, but it's very easy to see those sort of outliers in terms of where issues could be arising. Keeping your eye on end of life, once again, very important. When are my devices sort of hitting that end of life? How far are we stretching our devices past end of life? And not only tracking it by category like it is now, but once again, for budgetary purposes, looking at something like owning department, right? So if I switch this device in 2022, I can see that medical imaging is going to need to, budget for about $1.5 million for potential end of life replacements. Just to continue down the line, right, seeing things like if you're trying to do standardization efforts, right, which of our devices by asset type are the most expensive? So you can see which of your models by type do we service the best. So if you have standardization initiatives going on, this data can be very handy for those areas. And then just once again, cost tracking, right? Tracking costs this quarter by site and department. So in terms of being a director, an executive, right, I like to keep my eye on these things at all times, and I can ensure that that's happening in real time through my dashboards here. So now we've talked about that sort of end goal, right? This is the pie in the sky, but none of this is accomplished without having that solid data governance model behind the scenes. So I quickly just want to hit on a couple things in terms of how we're doing that, right? And we're going to talk about quickly an asset record, how we can control what's being entered. We're going to talk about our mobile strategy, right, on a work order and things like that as well. So how we can ensure that we're giving our technicians a very easy to use system to record information at the point of service. So for instance, what a lot of our customers are doing is aligning inventory to things like FDA UDIs, Flexera BDNA. We can, as you can see here, things like aligning to ECRI classifications and things like that, GNDNS, UNDNS codes. All of that information can be pulled directly from those sort of standards bodies and aligned to your inventory, so you can ensure that when you're reporting against an asset type or a manufacturer, that you're getting the most accurate data because you don't have a bunch of redundant information or duplicates and things like that. So what I'm going to jump into now is an actual asset record, and we're just going to talk about how we can control some of that information. And one of the devices that I want to use is the an imaging device. So what I'm going to do here is just quickly do a wildcard search, and what you're seeing here is just my list view, right? So this is looking at all the assets or all the devices that I have in my clinical devices table. I can do a lot from here. I can do wildcard searches against any column. I can use this filter, for example, to filter and/or conditions by any field found on the asset table, or I can simply do things like right-click and say, show me all my GE healthcare assets, right? So that's kind of gets back to the ease of finding information, right? We want to make that very easy and very simple for our users. So now that we're in this record, this is just a standard asset record, right? You can see all the standard information at the top, like the type. Any of these fields you see with the little magnifying glass, these are actually pointing to a record in another table. So I can see what my asset type is. I can see that it's a system. So there's a number of different operating components to an MRI, right? You could have all sorts of different things that could be tracked as assets themselves or parts or components. And then just to kind of go down the line, right? Who owns this? What's the location of this device, right? And we can enable RTLS. A lot of our customers do have RTLS solutions that they're using for this. so on and so forth. So what you'll notice too is this field here, for example, has an asterisk next to it. This means it's a mandatory field, right? And that's important because it's the sort of foundation for that data governance, that what we want to enable our customers to do is truly control what's being entered into the system before any record is ever, hit, right? It could be done through an approval process, a workflow, a manager approval, when a new model comes on, things like that. But our customers have complete control over this. So for example, right now the installation data is mandatory. If I wanted to, for instance, make the owning department mandatory, I can literally just right click this field, go to configure dictionary, and check a box to make that field mandatory. So very easy to do, very straightforward. As I scroll down, there's a couple main areas I want to focus on this record. And like I mentioned in the PowerPoint, right? Tracking things like only having one manufacturer record for something like GE, right? And aligning that data to someone like a BDNA who can, correlate that manufacturer to your inventory. So if GE goes and buys some new subsidiary, that can automatically be reflected in your inventory and updated on, your model and asset records. So, for example, here, you'll see how GE is spelt right here. It's accepted in this case. I can preview what's, under the hood for this record. But if I was to, for instance, say something like GE Healthcare and have a lowercase e there, apologize. You'll notice, I'm actually going to get an invalid. If I could get this going here. You'll see I'll get an invalid reference, right? So it's saying basically you can't input this information because you're not spelling it right, and there's already a GE Healthcare that exists. So that's how, one just quick example of how we're ensuring that the data that's coming in is standardized, and it's not going to be redundant or duplicate information because somebody capitalizes the E and somebody doesn't. Also tracking all the financials back to the asset, right? So any work that's being done, whether it be labor, materials, service contracts, rolling that not only back to the asset, but also relating it to something like a cost center is very important when you're, making budgetary decisions on, and repair versus replace sort of conversations, as well as automatically calculating a cost to service ratio. This is, system generated, it's built in, but this, people calculate cost to service ratio differently. I've seen it done, a number of different ways. So it is a configurable formula that we tend to change per customer desire. The bottom of the form, right, what you're seeing here is that full work history. So I don't have to search, I don't have to go to a number of different places to find this information. Everything is related back to the same place, to that same device record. So I can see all the work orders that have been done, whether it be, PMs, CMs, hazard alerts, safety recalls, what contracts is this asset related to? So I can see, we have a full service imaging contract for our Cigna Explorer units, as well as a number of other things, right? Any relationships that this asset may have, parts that it consumes, things like that can be very important to track. So that's kind of how we're protecting that information, at the asset and laying out that solid data governance foundation in terms of asset records. What I quickly just want to do as well is now talk about the mobile strategy, right? And so if I go into my clinical engineering technician dashboard and I want to pull a work order from the queue, right? What does it look like to actually close a work order? So if I look at the very top, and I'm not going to go through this whole dashboard, I can see what's unassigned. So I can come directly from my dashboard and see, okay, well, this unit has a work order against it. I can right from here say, you know what, I'm at this location. I'm going to assign this to myself, and then I'm going to start working this work order. So once I click into it, and right after, I'm just going to breeze through this real quickly, and then we're going to get into how we're doing this from mobile as well. So at the top of the form, you can see all that generic information that you would expect to see, who it's assigned to. If there's a work location, then you can use that RTLS strategy to know exactly where that device exists. I get like a Cigna Explorer unit, right? It's going to be in one room. But if you're doing rounds or something like that, you can see it's querying this one unit right now. If I want to get rid of that query and maybe use this map to accomplish my work, I can get rid of that and see where all my work exists on this floor plan. So we have developed, a native way to integrate with your AutoCAD system so we can digest those floor plans very easily for our customers. If there's any pre-checklist assigned to this work order, so I can see up here at the top, there's a pre-checklist that needs to get done. I can go in here and you know, make sure that those pre-flight sort of checks are taken care of, and then go about my work. So once I do that, I can then move it to, you know, a state of work in progress. And so then at that point, if I need to record labor, record parts usage, anything like that, all that's done from the work order. So I can come down here into my work order itemized costs. And for this use case, I just want to create a very quick labor entry. Say I worked today for, you know, 1 hour. It was in-house. This is how that information actually also gets related back to the contract. So if this is a device that was covered under contract, that information would be pushed back to that contract. And then once I go down, now you'll see I have a $100 labor charge basically associated to this work order. If I need to order any parts or anything like that, I can also do that directly through the work order itemized cost, or order parts from, you know, PartSource or GE. A lot of our customers are benefiting from direct integrations to you know, parts vendors like PartSource and GE and those sorts of people. So lastly now, I punched my time. If I needed to replace a part, I could have done that through the same work order itemized costs. And if I move this to a state of close complete and actually try and update this, you'll notice I'm getting thrown an error message here. And this is getting back to the data governance model of we cannot close a work order until we've filled out the desired information. This is how better decisions are made. So you can see I missed 3 fields. So if I come to my resolution tab, I can say, okay, well, what was my problem cause? And these are configurable to customers, right? We can say this was improper use, and my resolution code was like on-site service. And for the sake of time, finish work order. And at that point, I've now filled out my mandatory fields. I say, when did I service the device? It was today, and I can now close this work order out. Now that all the data's been, it's all there, everything's been filled out, and I could close that work order. And so now we just talked about how we can quickly close a work order and gather that information directly from the system. And I just briefly want to talk about now how we would also do this via the mobile application, right? So a big part of data governance comes back to what is your mobile strategy? How easy is it for your technicians to record work on the go, right? As budgets are being cut, people are being asked to do more with less. That requires, you know, a different set of skills, right? Of technicians bouncing all over the place, whether it be different sites or in the same location. So what you're seeing on my screen now is our Nuvolo developed mobile application. And you can see at the top, right now I'm connected. This works online or offline. So if we were to go through the same work order process, what I'm going to do is just click on my work orders there. And you can very easily barcode scan. So I can come to my asset, I can barcode scan a device, see if there's any open work orders on it. I can see that there is. I can go into this, start my work, and you'll notice a very similar experience, right? The whole idea behind this is simplicity. So I can start my timer. So now I'm starting a timer directly just by clicking a button for my labor charges. If I scroll down, you can see the same resolution code, resolution details, and things like that. Just like in the system, you have your checklist. So you can make sure, you know, you do all your checklists. You can see here any of the itemized costs that are taking place. So you can see I have some labor charges. If I need to add an itemized cost at the bottom, this is where I could add a part or something like that. And then lastly, you know, things like attachments. If you want to take a picture of the device, a lot of our customers are going through, you know, actual photo inventories of devices. If I need digital sign off, that's where I can handle all of these things as well. So if I just go back to the top, that's just a really quick overview. You know, I just wanted to show the mobile app relatively quickly, just so you guys get an idea of what we're offering our customers in terms of collecting that data the first time. So we're not swivel chairing, we're not taking paper off a printer and, you know, coming back to our desk and updating that information. We can see it in real time from our mobile app. So now, after I've sort of laid that out, now I want to start getting into the real sort of analytic portion of this. And we're going to now start jumping into a lot of different reports, a lot of different dashboards. And so the model that I've been using so far was that GE Cigna Explorer unit. So I just want to quickly show one of the things that we've heard of our customers doing is around competency reporting, skills, certifications, all of those areas. So if I look at this model record for my Cigna Explorer unit, what I mainly want to point out here is this technician competency list. And the way we've done this, and this is getting into how we make decisions about staffing, contracting, a lot of different areas. And the way that we've built this, and we can change this per customer, but once you finish 5 work orders against a particular model, you are now considered a competent technician at that model. So where this all then gets fed to, and this is automatically happening in the background, is our actual competency verification dashboards and manager dashboards. So we're going to spend the rest of our time here kind of going through these dashboards. And the first one I wanted to show was the clinical, or the manager skills and competencies dashboard. So what you're seeing on the left is just a snapshot of basically all of our models where our tech competency is listed. So this is in the use case of, say, Kyle Holetz, I'm leaving the organization, right? So I'm leaving, I've decided to make a career move, something like that. And as a manager, I need to know all the models that Kyle was competent in servicing, right? So I can add this condition. I just added a simple and condition there. I can run this, and then if I scroll over, I can see I have 3 potential problems right here in just seconds. It looks like Kyle, he's the only person that is competent in managing or working on 3 separate models. So that leads to the decision of, okay, we either need to put these models on a service contract, I need to train up another technician on how to service these models, or we just need to bring someone else in-house potentially to handle this, augment our staff with another technician or something like that. Also keeping your eye on certifications, right? So what certifications are expiring? So this can generate, notifications and things like that. Certifications by sites, so you can see things like where do I have pileups of certifications, or where do I have gaps, right? And if I look at skills and certifications can be tracked separately, but if I want to say change this report to by user, I can see where, maybe I have one technician at a certain site who holds a majority of my skills or certifications, and I need to sort of spread that out, right? This can also be used for reference by other technicians. So if I'm a tech and I need to know which of my colleagues has a particular skill in repairing x-rays, right? I can use these dashboards to track that. So the next thing I want to get into here is the actual competency verification. So what this is used for is actually verifying who's competent in what. So what you have at the top is essentially a technician selector. So if I select my own name, what's going to happen down below is it's going to query in the system all the models in terms of how many work orders have I done against each of these models. So you can see, at first, if I refresh this up at the top, it's showing everybody, right? If I refresh this one, oops, I got to select somebody else here like Ben, but it's showing everybody at one time. I didn't click on Ben. There's Ben. And you can see, very quickly and easily how many work orders has this particular person done against a model. So you can, instead of a manual effort that's done semi-annually or annually, you can have this all done for you in real time without a whole lot of extra effort. So the next thing we want to get into now is more of the compliance side of things. So the first report or dashboard, that I want to hit on is our PM completion dashboard. So this is used for a number of different reasons, right? And the point that I want to make with this is there's so many different ways that we can report on PM completion. It can be, overall by month, by quarter, by site, by region. I mean, I've seen it sliced so many different ways throughout the years. And really what we're trying to do is offer our customers that starting point, that template that they can mold into exactly what they need, that's form-fitting to their organization. So keeping your eye, like I mentioned, on completion this month against last month, you can see your percentages down below. Always keeping your eye on, what PMs have came in as unable to locate or in use, right? So we can record follow-ups and those sorts of things. As I scroll down, PM completion by region for our larger customers, this is very important. You need to see how you're doing PM completion across the country potentially, right? And even for some outsourced providers, this could be global. So keeping your eye on these metrics. Once again, just how can we slice this information? The point of this dashboard really is to show all the different methods that we can use to view and see tactical real-time information around PMs. So seeing it by site or department, what do I have upcoming, right? So knowing where spikes and upcoming PMs are, and I need to get more boots on the ground. PM completion by technician, right? So relatively straightforward. How are each of my technicians performing against their PM workload, as well as their percentages down below. So with PMs comes the topic of AEMs. So the next thing I want to get into here is our actual AEM plans. And I want to show that life cycle. And I've already created one for the sake of time. I didn't want to go through the whole process just because we only have an hour together. But essentially what you can do here is this request can be fielded from a technician, right? So the technician's going to fill out something like the model, the justification, and the suggested change. It's going to come in a state of requested. It's going to then be fielded by a manager who's going to probably move it to a state of open. And when I do that, you'll notice a number of fields become mandatory. So once you fill those fields out, the manager can say, okay, how do I want to qualify this AEM plan? Well, if I look here, I can see all my different KPIs that are automatically built into the system: operating cost, per device, operational expense. There's a number of different ones here that we can use, and these can be adjusted per customer. Once it's in a state of open, as a manager, want to qualify this. So I can click Run My Qualifying Report. What that's going to then do is create basically a qualifying report against this baseline range. So you have to have that baseline information in order to know how your AEM is performing. So if I open my reports page here, I can see, what is that reading in terms of my baseline range. So all of those KPIs, I've got answers to them here, and I can see, maybe, I think we can lower our operational expense. I think we can lower the mean time between repair or the number of failures. So as a manager, I say, I think this is a good candidate for AEM. I then want to move it to a state of approved. Once I save that, now in a state of approved, you can fill out when you want to start this AEM plan. Down below, your maintenance definition. So this is where you're recording what maintenance definition are we changing and what are we moving it to in terms of AEM. And then lastly, once you have your AEM, your new maintenance definition created for your AEM plan, you can then move it to a state of in production. At the state of in production now, you have an AEM review date, which will spit off a notification to come in and review this. Or you can come in at any time and click the button to run the comparison report. And what that does is it essentially looks at, you already have your baseline, but now it's measuring our AEM date range. And what I can do down here is click open the reports page. And really what that does is now I can in real time compare my baseline date range against this particular model versus when I've moved it onto an AEM. So I can see my metrics side by side, and this is really getting into deciding, was this a good decision to move this device onto an AEM plan? I can see my uptimes increased. What else? My mean time between repair, right? Failures have actually went up, it looks like. But there's a number of different metrics that are all pointing towards basically, was this a good decision? And the idea really is to have that one sort of simple place to track, AEM documentation and things like that. So to sort of wrap this up now, and I know we're covering a lot of information relatively quickly, I wanted to make sure everyone got the most out of this session. But the last thing I wanted to show here is actually the EOC dashboards. So what I've seen from EOCs is it's generally four main components in terms of what I've seen out there. Now, everybody, once again, we can do these things differently. Scheduled maintenance being one, unscheduled maintenance. Things like hazard alerts, safety recalls is the third. And then I've seen, people generally include like a floater topic, right? Like, what do we want to improve on? Maybe it's abnormal damage. We want to cut back on the amount of training issue or physical abuse work orders that we have in our organization. So this dashboard acts as that central hub to track that EOC. How can you ensure that you have a safe facility, safe operating practices for your staff, and also, very importantly, your patients. So the idea behind this really is these are constantly rotating, right? And quarterly, annually, we're rotating these reports. And what we want to give to our customers is a singular hub where they can set these reports up at one time in the beginning of the year, and then as work's being completed, this dashboard is being constantly updated, so you have a real-time view into how you're doing in terms of your EOC. So the way I've built this is basically to correlate between single score to a graphical report. So scheduled maintenance is obviously our PM workload, right? So you have single scores of particular areas of focus in terms of PMs, and then you have a trend by quarter, by month, where you can actually see your compliant percentages and things like that by month. You then have unscheduled maintenance. So very similarly, those single scores for unscheduled maintenance, with a correlating report here, a graphical report of showing, out of all of our correctives, our tech requests, our new equipment inspections, those types of things, are types of unscheduled maintenance. How are we doing with that workload, right? What have we closed? What's work in progress? What's open? And then lastly, right, other work, so things like potential incidents, patient injuries, hazard alerts and recalls, how many devices have we retired, stolen or missing devices. So keeping an eye on all that information. If we need to drill down into that, right, it's very simple. I can click that and see exactly which of my assets are, have those characteristics. And then of course at the very bottom, you have your report that is correlated to, that single score. And then one of the nice things about this is, say I want to change one of these reports, right? Nuvolo offers this out of the box. We say, here are all these out of the box reports. They're already set up for you, but they might not be totally form-fitting. So you can directly from this dashboard, click something like the edit widget. And then what that's going to do is it's going to push you directly into the reporting engine where that report was actually built. This catches up with me here. So now it caught up. And now what you're having a quick peek at is the actual reporting engine behind the scenes, right? So what this is looking at is, just to quickly run through this, and all of our customers have access to this. So you can build your own reports. You can see it's relatively simple. It's just a drop-down driven reporting engine, but it's very robust. Every table, every field in the system is reportable. So you really can report until your imagination's desires in terms of all the different reports that you can create. So you can see, what table are we reading this data from? Clinical work orders. How are we digesting it? It's a bar chart, right? How are we grouping it? Well, we're grouping it by site. I could group it by department. I could group it by technician. Basically any field on the work order record. How are we stacking it? So we're stacking this information by state. And then we're actually creating our conditions down here to essentially pull in the specific information that we're looking for. So we're looking at, only recall work orders that were created on this year. So if I wanted to change this information and maybe say, group this by something like the department, I could say, open up the asset record here, and I can actually dot walk into other tables that are referenced on this work order here. So I believe my field I'm looking for is owning department here. I can add this to my report, save it, and then what you'll notice is that will add an additional characteristic to my report to now taking my hazard alerts, and instead of grouping them by site, I could say group them by owning department. So where are these hazard and safety alerts coming from? Looks like emergency, cardiology, or surgical departments here. So that is about almost everything I wanted to show here. The last thing is just a very simple platform feature, and really all that is the EOC reports are constantly passed around, right? Between everyone has their own portion of this that they're contributing to. So printing them out can be very, beneficial. So every form, every list in the system has this printer-friendly version associated to it. So you can very easily click on this, and you can still, for certain situations, print work orders. You can print these dashboards in a relatively good-looking sort of graphical format, right? So you can see here all of that information. The lists reports, those have been opened up, so you can actually see the information that's under the hood. And then you can hand these off to leadership, to other departments, whoever needs it, right? So that holds true to every form, every list throughout the system. So you always will have that option to print things out if need be. So that is about everything that I had planning on covering for you guys today. I hope that you all found this beneficial. We have about 10 minutes for Q&A session, so I'm going to let our fantastic proctor here throw me some questions. If you have any questions or want to learn more, I've put up sort of the slide here to email us at sales@nuvolo.com, or schedule a live product demonstration, or see some of our pre-recorded demonstrations if you follow the link. So once again, thank you all very much for spending some time with us, and I'm looking forward to hearing some questions here.
Great, thank you so much, Kyle. Yes, we have got a few questions to get through. The first one is, can I track similar parts from different vendors or OEMs with the idea of one being preferred over another?
Absolutely, yeah. So we do realize in terms of parts and inventory, right? different vendors offer different parts, and a lot of times we have purchasing contracts and those sorts of things with some of our vendors. And what I've seen a lot of our customers do in regards to that is we can actually flag a particular part as like a preferred part. Therefore, on the work order, when a technician is searching for that part, it could actually, you could create a PO or pull it from your inventory if you're keeping some kind of standardized inventory, and you could only order, say, what's the preferred part for, you know, this year in terms of the maybe a purchasing contract we have. So absolutely, yes, you can do that.
Okay, so am I able to report on parts and labor spend that's going to OEMs by my different sites or even by quarter?
Yeah, absolutely. So that was one of those reports that I had on that finance tab, was actually what are our service, you know, how much service are we sort of subbing out to a vendor? How much expenses, you know, are we sending to GE or to a Sodexo or someone like that? And you can break that down. You know, you can have the overall approach where you're reporting on expenses in total, being labor, parts, anything like that. Or you could even break it up into specifics, right? Like how much service costs are we sending to this vendor and this outsourced vendor? How much in parts costs are we sending to this particular vendor? So yeah, you can absolutely report on that, and you can slice and visualize that data in a number of different fashions.
Okay, that's great. I saw that you had parts purchasing integrations with PartSource and GA. What others do you or could you have integrations with?
Great question. Hypothetically, we could essentially integrate with any parts vendor that has some sort of open API offering, right? So the ServiceNow platform that Nuvolo is built on is considered an open API platform. I've seen integrations get built, you know, in a number of different ways, whether it be, I don't want to get overly technical, right, but sort of standard practices, web services, REST or SOAP interfaces, or even updating like a mid file. So as long as that parts vendor has some sort of integration interface, I'll call it, for us to sort of sync our hooks into, we could integrate with them. So currently, right, we just have the two main ones, mostly because, you know, PartSource is a partner and GE is also a customer. So we have a lot of synergies between those sorts of vendors.
Okay, and another question is, you showed the vendor tech user only having access to work orders assigned to them. Would it be possible if I also wanted to let them view the asset records that they service?
The vendor tech, okay, so that must have got caught on one of those dashboards that I showed. So yes, what we've done for that is a lot of our customers we have what's considered, like I mentioned, the system is a fully role-based system. So what that means is we can create a group called, you know, vendor technicians and assign a particular role to that group. So whether it's a GE or a Siemens or a Sodexo tech, they can actually log into the system and only see data that's specifically assigned to them, whether it be work orders assigned to them, or it could be potentially like an imaging equipment or a particular device that's owned or assigned to that person. We can absolutely create roles to show, you know, those vendor technicians only having access to what they're privy to in terms of what your leadership has decided you want them to have access to. We also have rolled out, you know, things like vendor portals for some of our customers. So managing, if you're a heavily outsourced shop, managing those users coming in and out of your location, right? And seeing in real time what work you have subbed out to them and allowing them to update that work in the system, as opposed to, you know, handing a manager an FSR at the end of my trip and then having that manager or that technician go and update the work in the system. You know, so there's a lot of things we can do in that regard.
Okay, and another question here is, our health system has a corporate-wide tool used to track contracts across the entire business. Could the contract data being captured in Nuvolo be easily ingested by that tool?
Yeah, absolutely. I mean, that kind of gets into the conversation of do we want to build, you know, an integration to that system, which could be absolutely possible, like I mentioned earlier, if that other contract system has, say, an open API that we can plug into. Or additionally, if it has some way to digest information in a mass fashion, which most of those tools do, as far as what I've seen, you can export information just simply by right-clicking on any. So I showed that a couple of list views of work orders and devices there in the system. Any of those lists, and it could be a contracts list view in this use case. I can right-click, export that list out in a targeted fashion of just the fields that I want. I can export it to Excel, CSV, PDF, a number of different formats, and then actually just upload that directly to that contract tool if that's the route we want to take, or additionally, like I mentioned, a potential integration.
Okay, that's great. We're actually coming up to our hour now, Kyle. So we have got some other questions which I will send to Kyle offline, so he will answer at his own convenience. So please be patient. He will answer you. So thank you once again, Kyle, for a great and informative webinar. And thank you again to today's sponsors, Nuvolo. One lucky attendee will win an Amazon gift card for completing the post-webinar survey, details of which will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. Thank you once again for joining us. Enjoy the rest of your day and see you again next time.
Thanks, everybody. Have a great day.